push the probe in, you have to see where you're going. So the landmark for me here is that this is the urethra. So it tells me my angle, which I know the angle of the probe, that this is the anterior vaginal wall and this is the posterior vaginal wall. And now I bring my urethra from view again, anterior vaginal wall, posterior vaginal wall. And this is the tip of the probe at this point here. And I'm sliding behind the bladder, I'm lifting the probe up, so I follow the vagina. And by following the vagina, you don't cause the patient any pain. Very important that you use an ultrasound machine to help you guide the probe in the direction it should be inserted into the vagina. And then you come up and now you see the view of the cervix, and then we come down to looking at the baby. So this the first thing is like, I did not see this, appreciate this as an abdominal scan. It's our jugular lymphatic sacs. So the first thing I realized is by doing a vaginal scan is I'm getting more detail with regard to the jugular lymphatic sacs, which I had not seen earlier. Once I'm in this position as well, the very magnified image of the baby's head, I'm also seeing an image of the baby's ears. I did not see this at the vaginal scan. So I'm going to set my quality to max, put my volume angle to 80, increase my acoustic output, and ask the patient to stop breathing. 5, 4, 3, 2, 1. And then when I've got my image on it, I can then come around to looking at the side of the baby's head and then catch the fetal ears. What I'm looking at on the side of the ears is to see whether there's any low set ears. As I come across, I just put the edge of the ear just coming in here. And I'm looking as I come across the baby and translate it to the face is to see whether there's any low set ears. Again, low set ears is one of those things that's a feature of many genetic syndromes. So if I come across that in the onset section and then come down, I want to look at the anatomy of the baby's brain again. So I get clear details of the aqueduct sylvius. So I come across here, here's my aqueduct. This is the mesencephalon, this is the thalami. And if I freeze that image, this here is the thalami here, and this is the caudate uterus here. This is your caudate-thalamic groove, the area where hemorrhages occur late in the pregnancy. When I look at the 3D image of the brain, stop reading. 5, 4, 3, 2, and you can then look inside the brain, using a surface rendered image of the brain. You can come around, translate through the brain, and you can see the choroids present within the fetal brain. You can magnify that image. Around. And as you look at this, you can appreciate here that this is the fluid inside the fetal lateral ventricle. When I'm looking at this thickening vein and deposit, what I'm looking at is to see the proportion of fluid that produces the choroid and within the fetal brain. I also see if there's any deviation of the thoughts. And then as I look down here, I'm now looking into the cerebral fourth ventricle. And as I look at changing the light source, you can appreciate that this here, down here, is the dilation fourth ventricle. Just down here, that's all the dilation fourth ventricle. The down suspicious is the lake patch. Coming to examine the baby's heart, you can see that the baby's in not good position. I was hoping I'd get clearer images of the baby's heart, but I don't think so. But don't give up straight away. There's easy option of inverting the image. And then once you've got your image inverted, sit down your sector width. And then when your sector width is down, then go in and zoom in the heart. And then when you've got zoomed in the heart, hit a button on the lens, which just gives it more penetration. And now I can see the pulmonary valve. So this is the dilation duct, because the baby's got aortic atresia. And when you've got aortic atresia and left ventricular atresia, the pulmonary artery is enlarged. So you've got dilatation of the arterial duct, and this is the pulmonary valve. So I want to know, when I look at that valve, I want to know if there also pulmonary stenosis. Sometimes babies will have more than one cardiac enlargement. Remember, because the baby is at the first semester, is that you can scan through the ribs. So that's why I'm inverting my image. You cannot do this in the second trimester of pregnancy. That uses a very different position. Okay. just go back and start from scratch, like that, and back to the And also, when you look at the spine of this baby, you can come around and evaluate the spine as you come across here. If you're in a position where you're finding it difficult to get the spine at a dominant stand, you always have that option of doing a 3D volume acquisition. And when you do that, you take a volume of about 55 degrees, catch the full length of the spine, and then application of the breath. This is important section to get the baby, what is the excluding spinal bifida. You know that 30% of babies with spinal bifida, and you will pick up an abnormality in the spine by looking directly at it. So you don't necessarily need to rely on the the head signs. As you come up this image of the baby's spine, it's a nice view when you look at the ribs, because the babies who've got sleep dysplasias, you will have stiffening of the ribs. You can see these ribs here become normal. So it moves during the acquisition, and while it's not giving nice imaging of the vertebral bodies, it did give you nice images of the spine. As I come to this image here for the baby's head, I can see down the vertebral column. So this is the vertebral column, this is the atlas, which is just as the cervical vertebra enters into the baby's head. And so this here that I see the jugular lymphatic sac on this side. As I do so, I also see coming across on the right and left side, you see the lung fields and the diaphragm. A very nice tool on 3D is using BCI. So if we take a image on that, stop breathing, 5, 4, 3, 2, 1. You can go to multiplanar, and when you look at this image here, you can appreciate the lung field. So if you look here, you can see the liver, but it allows you to see in detail the diaphragm of the baby. And that's the power of 3D. And you can also add by increasing the volume speculum. So that's a BRSI, volume speculum, we've got an image of 5, which is a very nice setting. And you look at that, you can see, come across and see that you have a normal and intact diaphragm. You can choose to demonstrate multiple segments as you come across the chest as you look at this. It gives you a very nice demonstration of a normal looking lung field and normal looking liver. You can also use volume contrast images to make it even more striking of the difference between your lung and your liver. Okay, the other patient, that's the matter.